I was reporting budget stories. Something that struck me was that I couldn't tell how much money the government was going to spend on health that year. I mean, there's nothing in the mind of a journalist as disturbing as knowing what you want but you can't get it. So that's basically how the idea came. The first place that I started looking for the data was the counties. But the challenge that there was that there are counties that didn't have anything on health at all, or they didn't indicate anything on health. There are counties that just put all the development that they are going to do their development budget in one kitty. So you can't tell if it was how much will go for infrastructure, how much will go to education. So I narrowed down about 17 counties that had those kind of challenges. So we had to physically call the counties. Then the rest of the data came from Treasury. We had some data that had already been collected by Internews on the data dredger site, and that was a good place to start from. And then the other data set that was important for my story came from the Kenya Health at a Glance. The biggest challenge was to break down this data into a way that will get me the story that I'm looking for. So I was able to drop my data set to some experts who basically do a lot of budgeting and at the international budget partnerships who do a lot of analysis of data, and ask them in terms of which indicators would I use that will be best tell the story of devolution and health. After that, I was able to share it with one of the data analysts here at Internews.
When he brought me the data, of course I had to verify, find out if it's significant. We were able to sort to rank the data in various indicators and determinants of health. Then after that we ranked the counties. Then we were able to know which county is best depending on those indicators of health, which is the best and which is the worst. Then we were able to compare that to the county budget allocation, development budget allocation on health, the health component. So we're able to bring the two together and now say, if this county is number last in terms of health, what is it doing in terms of allocating resources towards that?
If you find 30 counties slashing budgets, that was something that we found very of a great concern, especially in terms of the healthcare system in Kenya, the way it is. So that is the straight story that came out. And the second story was that the counties were yet to really understand or appreciate the real needs of the people. So it was a bit of misplaced priorities, a kind of a story that tells people who are budgeting for people that they do not understand. Yeah. One thing about data is that you cannot sell a story about numbers. It will not just pass anywhere. So you have to find a human side of that data. The first thing that I realized was that data, once properly analyzed or put together, you'll always find it sending you to the right places. So I didn't struggle looking for the people, because all the data will just tell me that here is the right place for trachoma, and here is where there's no doctor. I picked on West Pokot because the data will tell me that West Pokot will have a local problem of trachoma, and it was also a least spender. Kilifi was an issue of elephantiasis because a neglected tropical disease, and secondly, it was a least spender in cost in the whole of Coast region, which has about 6 counties. So I wanted to understand why will Kilifi spend less than the others, and two, how are they planning to tackle the issue of elephantiasis, which is also a regional disease for the Coast region. In the current news environment, that we have a critical audience that is mostly served by the online platforms. So you find that you want to basically have a digital presence to be able to serve this audience. But secondly, you want to have something that is user generated.
You can imagine if I give you data on a Microsoft Excel format, you won't be able to analyze it at a glance. So the news app makes it easy for you to analyze the data by visualizing. Yeah, it creates graphs for you, so it makes it easier for you to understand the data.
It is more interactive. You have videos. People love watching video. People like maybe maps. You have some maps there to interact with and to get exactly what they want. People who like the real hard numbers. You have the numbers there. So whatever someone wants, then they go on the digital site, they can go to get what it is. So that's why I decided that because I have so much data, it will be a waste for me just to just leave it on the print and leave it as such.
I had data in a Microsoft Excel spreadsheet. So what I did was that I exported the data into a comma separated value format so that I could save in a database. I used Google Refine to clean the data, to like eliminate redundancies and do clustering, to eliminate repetitions. Then MySQL was for storing the data in a database. So that was the database storage engine. It stores the data. Then PHP is the language that processes, the language that fetches data from the database and gives it to the user. Then Google Charts creates graphs of the data.
The story I've done, if I had just done it without data, my email now will be full of questions, everybody asking me, this is not true, everybody wanting to know how I arrived at this. But with data, all I've gotten is people telling me like, look, Wafula, this story, we did spend less, but we are planning to spend more, so that already people have accepted that whatever I've presented is true because it's the data that they have, and they can easily be able to corroborate it because all the sources I've gotten, they're in their own budget. So in terms of the issue of the fallback that always comes to a story that sometimes is investigative in nature, that bit I haven't been able to see on this story.